Thank you very much to HITLAB for having me. As they mentioned, I'm April Smith-Hirak, and I am the Regional Health Administrator in HHS, the Federal Department of Health and Human Services here in New York. I very proudly work for Admiral Rachel Levine, who is our Assistant Secretary for Health. And the job that I do is really unique. I get to take a policy level look across all of the areas of the Health and Human Services Department and really think about, in my job, where we're going as a country, where public health is going, where the digital health and other spaces are moving us, and how does the federal government both enhance and enable those that progress and those initiatives while protecting the public. And that's not always an easy balance to strike. But I feel incredibly lucky that I get to be the person who thinks about that and comes back with some of those policy recommendations and gets to understand what's really happening across a very large and vast department. So for those of you who maybe aren't as federal government speak-minded as I am, we house many familiar names within the Department of Health and Human Services. So anyone who's ever heard of CMS, just Medicare and Medicaid, they're within our shop, the FDA. We have HRSA, we have NIH, we have CDC. So all of these different entities are housed under Health and Human Services, and each of them have a little piece to play within the digital health and emerging health technology sphere, and each of those roles is pretty unique. So we have this tendency to silo ourselves a little bit, and my office gets to be that office that looks across all of them and really thinks about how we can bring our office of the National Coordinator and some of our other digital and emerging health innovation hubs together to really create a comprehensive approach. So before I go any further, I really just want to acknowledge the Breakthrough Alliance and congratulate you for your 8th year of the Innovators Challenge. That's wonderful. This is not the first Innovators Challenge that I've had the privilege to attend, and the caliber of the companies that they bring in are always really great. And I want to congratulate the finalists because it takes a lot to get where you are, and it takes a lot of energy and a lot of stamina to really be able to make it to this final round of a pitch competition and really share your ideas with the world. So congratulations to all of you. We really are living in some amazing times. The pace of innovation is accelerating, and the things that we only imagined a couple of years ago, what if that might be possible, are now really not just possible, but they're maybe even becoming obsolete as we speak. Just several months back, GPT technology, which has been in the background for several years, emerged into the popular vernacular with ChatGPT, and it's really changing the way that we think about things. It's accelerating the ways that we can innovate. And from AI to devices and all of our solutions, there's an opportunity to change that landscape of health and think about what we have always thought about in public health. So when we think about healthcare, the traditional healthcare model is focused on sick care. So you really access healthcare when you're already ill, usually. We talk a lot about prevention and a lot about value-based care. But what's happening with some of these technologies is that it's making the principles of public health really possible and accessible, because public health is about enabling everybody to achieve their best health. And that means a lot of prevention, a lot of catching things early before they become problems, and a lot of enabling people to live healthy and disease-free lifestyles before they would ever develop a disease. So I think that a lot of the innovation that's happening right now is actually really supporting public health, and it's very exciting. And with that excitement comes a lot of responsibility. I think it's really important that we acknowledge that we are existing in what has been, if we're thinking of it as 1.0, a health system 1.0 that is intrinsically biased. It is based on gender and ethnic norms that are perhaps excluding a significant proportion of our population. The data that we use sometimes to feed some of our innovations is also intrinsically biased. If we're creating an AI algorithm that is based on medical claims data, we need to understand that not everybody accesses the medical system at the same point in a disease state, and that not everybody gets the same care when they do access it. So if we're basing our AI algorithms on something like that, then we need to acknowledge and try our best to correct for whatever that bias that's already existing in our system is. So the fear for me, the thing that keeps me up at night, is what happens when we begin to iterate on some of these things and we have machine learning and deep learning that kind of takes off technologically. And what starts as, the reality that we're in right now, which is a biased 1.0, can sometimes spin out into an incredibly biased 2.0, and that's exactly what we want to avoid. On the other hand, there's great cause for optimism, because if we really realize the opportunities that we have, and we build into our system equity, and we build into our system going forward access and affordability and culturally and linguistic appropriate care for every member of our community, then that is the system that we'll have in that 2.0 going forward. So while there's a double-edged sword there, it could be really, really bad. It could be really great. Probably the reality right now is in the middle. And the federal government is working really, really hard to shift and guide this process and create opportunities for that equity, for the elimination of bias, for innovators and founders to have a place to grow and to share and to really drive forward that potential health gain. And it's kind of cool, because in healthcare and in digital health, which is where we're all standing right now, there's a great synergy in priorities, because equity and inclusion and diversity and access are all things that drive market share, that drive ROI. So we all have similar goals, even if the federal government's goals are for, altruistic and not an ROI, unless maybe you're administering Medicare. But if you're looking at where you are looking at cost savings, or where you're looking at how you can prevent disease, how you can provide access to people at earlier disease states, we're really looking at places where you can create increase market share, you can create a better product, you can create the things that will also drive the market forward, and that's a great synergy. So please bear with us, because the federal government's working really, really hard. The FDA is releasing new guidance all of the time. There's real-world evidence in clinical trials. There's decentralized clinical trials guidance. There's all sorts of things that are coming forward that are really, really helpful. And that's just from FDA. If you look at CMS, they have their CMMI, but they also have a tech transfer office and all sorts of folks. And, we have our Assistant Secretary for Preparedness and Response, which is now becoming an independent agency under HHS, the Agency for Preparedness and Response. They have a group called BARDA, the Biological Advanced Research Directives Administration. And they are in charge of making investments in emerging technologies that can help us in emergency and pandemic situations. And they have a remarkable program called BARDA Drive, which is a public-private partnership that operates like a VC that invests in these companies and helps them to grow. NIH has an SBIR program that is phenomenal, that invests in early-stage companies, and it invests in a way that doesn't dilute equity. So their whole goal is to, in each of the institutes at NIH, provide these SBIR grants to companies that really help them to grow, to provide proof of concept, and to bring products to market that improve the health of all. And then finally, the ARPA-H, which is, it's our new crown jewel in the HHS family. They're the Advanced Research Projects Administration for Health, and they are fantastic. They have hired program managers who are among the most innovative people in emerging health. And they are charged with making investments to radically disrupt markets and really bring incredible solutions that nobody thought was possible forward on a 3-year investment cycle. And so we're really pushing forward in the federal government to try to provide this ecosystem and to be supportive. And also still doing things like the Office of the National Coordinator, which is, just promulgated TEFCA. TEFCA is an information exchange that allows you to exchange information in a trusted way. And so there's some of the more standard and perhaps less exciting and interesting, but really necessary guardrails and systems and things that we're trying to enable. And then there are some new things coming. So, in conclusion, I just want to emphasize that we really do have these common values. Every single one of you who is innovating and creating or investing in new products, and you're looking for market share, but that market share is really not going to be there if you're not improving the health of the clients and patients that are going to be your bread and butter. And so those are the same people that we want to keep healthy. And the more we include different groups of people, the more we are mindful about the way that we're innovating and inclusive and equitable, I think the healthier, the better we'll all be, and the more the companies and the investors will prosper. So thank you very, very much for having me today.